Hello, everyone. Welcome to our lunch series. And this week we're discussing COVID and mental health. We have some great experts on our panel that will kind of discuss the fallout of COVID, what the future looks like, and looking back on the past. So without any further ado, we will get started. We have Karina Easley as our moderator who will be moderating the panel, and we'll start with introductions.
Hi, everybody. My name is Karina, and I'm a health analyst, and I am located in Memphis, Tennessee. I'm here because I believe it's imperative we start the conversation about mental health and to equip people with the knowledge. I'd like to say thank you for being here, and thank you to Dream Launch for giving us this platform. First, I'd like to introduce Dr. View. Tell us a little bit about yourself.
Hey, good afternoon. My name is Dr. View. I'm a psychiatrist based in New York. I'm the chairman of a psychiatry department and the founding residency program director of a psychiatry residency out in New York. I also have my own private practice called Enlightened Insight, which is based in Manhattan.
All right.
Next, I'd like to introduce Dr. Goodwin.
Hi, hello. My name is Dr. Erica Goodwin. I'm a double board certified psychiatrist. That means I'm a child, adolescent, and adult psychiatrist. I'm also an integrative lifestyle coach. I live in Atlanta, but I am known for being a traveling psychiatrist, but I do have a telepsychiatry practice named Goodwin Medical Associates.
We have Dr. Williams.
Good evening. I'm Dr. Samuel Williams, and I am a child, adolescent, and adult psychiatrist. I'm currently the medical director of behavioral health services at Total Health Care in Baltimore, and also interim medical director of Mary Center, their inpatient, outpatient mental health services. So I'm in Maryland, DC area. So
Thanks. Welcome, Sam. He's also my classmate, MBA, Kelley School of Business, 2019.
yes.
And lastly, we have Travis. Go ahead and tell us a little bit about yourself, sir.
Hello, I'm Travis Meadows. I'm trained as an adult psychiatrist as well as training in public psychiatry. I'm based in New York City, where I currently work full-time for a city-funded program instituting collaborative care in a public hospital system. And then I also co-run a group private practice with a colleague of mine operating in Midtown Manhattan.
Just in general, across the country, a lot of people have been anxious about finances, not sure about their future, and grieving losses of loved ones, worried about health, and being cooped up in the house all day. A lot of people are dealing with anger, anxiety, depression, and unhappiness. And so lately, my family has been meeting and starting the conversation about where we are emotionally. So Travis, I'll direct this first question to you. Can you speak on removing the stigma of mental health and the importance of normalizing the conversation?
Removing the stigma. I'm someone who checks social media a lot for humor, but also to know what people are thinking and are feeling. And what I've noticed is this sort of, it's done in a humorous way, but people really making fun of the sadness and the loneliness that they're experiencing. And, my experience as a psychiatrist and also just as a Black person who predominantly treats Black communities, Black, brown communities is, I think what contributes to our stigma is the things that will cause us to seek treatment are also experienced in isolation. So our sadness is something kept quiet. Our experience with domestic abuse, other violence and things are kept quiet. And I see what's happening now is there's this shared experience. So the trauma of your family being in the hospital, stepping outside of your apartment, worried about being sick, the exacerbated poverty is there's almost this openness about it, at least in New York City. And I'm curious, and I guess I'm optimistic that maybe this openness about what everyone is experiencing together for our community may make people more open to getting help for it because it's already a shared problem, a known problem that has light shined on it. And I hope that sort of, you know, as people have more of an opportunity to seek out mental health resources, that the fact that it's known that we were all lonely and struggled to adjust to these circumstances will actually make people more comfortable with the idea of getting help for it, because you're not crazy to go talk to someone about it. You're actually just being like everyone else.
I mean, I think one of the things that we have to really challenge is, especially for people within our communities, being able to find providers that share the empathy, that truly relate to what we're going through. And I think that's one of the struggles that we have. I can speak, you know, going to what Dr. Meadows was saying, as a psychiatry program director, one of the issues that we face is, you know, making sure that we have enough people of color that actually are going into the field, and people, and even it may not be people of color, but at least people that can have the empathy that's needed to actually care for the patient, being able to form a strong therapeutic alliance with our patients, and also understand the communities that our patients are coming from. So I think, I mean, it's great. You want people to be able to see the value of mental health, but even if they do see the value of mental health, how are they actually able to form the relationships and have the relationship with providers? I think that's the next struggle that we have to contend with.
So you kind of led me into the next question. And Dr. View, can you please just talk about what's happening industry-wide, some of the long-term challenges for the patients and providers during this pandemic and after?
Well, one thing I do want to say, Dr. Goodwin, Dr. Erica Goodwin, I've known Dr. Goodwin from almost 20 years, okay? And I think she's like almost a perfect person when she mentioned her new private practice concerning telemedicine, telepsychiatry. And within psychiatry, out of all the fields of medicine, this is the pristine, this is the ideal relationship. So the fact that we are actually going to that perspective, and also going back to my previous issue of actually making sure that people of color are able to connect with empathic physician, it goes back to what Dr. Goodwin is doing, in which I know her practice will be profoundly successful, is being that the numbers are so small, but yet the demand is so high. I mean, already we're seeing the disproportionate number of people of color that are suffering from the pandemic. And, you know, we can make these excuses, going back to what Dr. Meadows was saying. I mean, you see all of these memes about, you know, we're not social distancing, you know, so on and so on and so on. But I can tell you, living in New York City, I know physicians that have gotten the virus and that have died from COVID. So you cannot just demonize, saying that, well, the reason why we're getting the virus is because we have hypertension, we have diabetes, we're not taking care of ourselves. A lot of us are actually in the front lines. A lot of us have jobs that are not, you know, the aspect of just being at home is not really, doesn't really pertain to us, because we're basically essential workers. So I think when we talk about from an industry perspective, the concept of telemedicine, telepsychiatry is big. I think it's here to stay. I can say that in my program, you know, there was some hesitation towards telepsychiatry, but once this started, I was adamant that we started telepsychiatry immediately. And after this, I had a couple of social workers that told me that by us going into telepsychiatry so fast, that actually helped them, because they had at least 10 patients that tested positive for COVID. So if we had delayed, talk about from a business model, my entire outpatient clinic would have been exposed to it. So now we're actually in the process of bringing in telepsychiatry within our inpatient component, as well as our emergency room and our consultation liaison service, which is basically the service of psychiatry helping out the medical doctors within the hospital. So I think from a business standpoint, the concept of telepsychiatry is a big, big, big changer. And I predict that because of telepsychiatry, you will see for the next residency cycle, you see psychiatry becoming much more popular, whereas traditionally very competitive residencies such as emergency medicine, that may actually go down because there really isn't that option of actually being able to provide the telepsychiatry telemedicine component. It's not the same. Whereas psychiatry is a perfect segue for that.
As Dr. Vo brought up, there are some unique opportunities that are coming out of this, that there have been the need for people to have very quick pivots into telepsychiatry when previously they were in-person practices, which is causing almost an unprecedented amount of access that people can have now, that instead of having to travel for your appointment or have all of this time commuting and waiting in the waiting room, wondering who's going to see you in the waiting room, that now telepsychiatry is opened up for almost everybody, because even the community mental health clinics, a lot of those switched to tele. So now people have the opportunity to see people privately from their home. The only thing you really can't be doing when you have your appointment as a patient is driving. Nobody will see you while you're driving, but you can be in a parking lot, because most of the portals, you can be on a phone, a tablet, or computer. So it's the only real barrier is having internet access. But if you have any kind of data access, and right now, because they've released a lot of the recommendations or regulations around it, people are doing phone visits also, that the entry is very low. But I think it's going to totally change the environment. Number one, there are going to be people concerned about multiple waves of this pandemic. So from a provider standpoint, we don't want to necessarily be exposed, but also if we get exposed, then we expose multiple people, and our exposure then gets multiplied because we interact with so many people, that you'll lose this exposure. But also it's going to be so much access that I think the patients, there are going to be a certain amount of people that don't want to go back to going in and seeing someone all the time, when they can just turn on their phone, turn on their computer, push a couple buttons, and then they're seeing their doctor. So I think it's going to cause a humongous ripple around the community, because like different places that were a little bit more archaic and not willing to shift and pivot are going to definitely see consequences of them not doing a quick pivot.
Yeah, I think I'm the only non-psychiatrist in the room, and I'll say medicine as a whole is never going to be the same. People aren't going to want to come to see us anymore. You know, people get shot and they're like, "Hey, can I just see you on TV and tell me if I'm okay?" So I think the industry is changing altogether, and probably for the best.